Welcome to our discussion about women of color and healthcare equality. I'm Leslie Farrington, and Beverly James is my partner in this effort. We are members of Pulse Center for Patient Safety, Education, and Advocacy. I'm a retired doctor. Beverly's a nurse. My focus now is educating the public about safety in healthcare. Patient safety is basically about reducing harms from preventable medical mistakes. Preventable medical error is the third leading cause of death in this country. And racial inequality is a major contributor to preventable deaths in African Americans. It's estimated that 886,000 African Americans died between 1991 and 2000 due to inequality in healthcare. It's important for me to note that I'm African American, and I've been a unique witness to inequality in healthcare.
Well, Leslie, you know I share your passion about educating the African American community about healthcare issues and safe healthcare. But you know what really bothers me? Is the medical community has been so slow in responding to this need. And you know what? I discovered that when I was a student nurse, because I found that my classmates were ignoring patients who were Black, who looked like me in the bed. We were able to choose our patients as we were studying, and none of my white classmates chose anybody who looked like me. And that was really disturbing. So to give an example about how serious this problem is, I have some statistics. African American women are 3 to 4 times more likely to die during and after pregnancy. The infant mortality rate is higher. And the death rate for breast cancer among African American women is higher than for white women. And this affects African American women no matter their educational background, whether they're rich or poor, or whether they have insurance or not.
There's been more than enough study of this problem, and plenty has been written and recommended. But research on medical care confirms that subconscious racial bias leads to unequal treatment and poor outcomes. African Americans get less pain medication after broken bones. There are fewer tests for heart disease done on African Americans, and white doctors spend less time with their patients of color.
So I know that we were talking about this before, and we looked at strategies for all people to get good health care. 1, ask questions until you understand the answer. 2, know your medical condition and medications. 3, speak up to avoid errors. What do you gain? You gain your life. You become a participant with your doctor as you decide what treatment plan is best for you, what the pros and the cons are, what the risk may be. You also get to understand what you should expect and how you might feel as your treatment plan moves on and as you start to get better. I also know that when we use these tools, sometimes people are a little nervous about it. So you need to be able to engage your doctor and speak to them in a friendly tone. You can ask questions. You can note that they may have pictures on their desk, and you can ask, is that a family member? Ask them about their hobbies. It makes that visit more humane. You humanize your doctor, and the intimidation is less. I also know that if one is in a doctor's visit and you begin to feel that something's amiss, don't be afraid, speak up, and you can ask them, Doctor, do you have any African American patients? Are you in a hurry? Are you pressed for time? If they act surprised and, are concerned, then I'm sure you can work with them. But if they become annoyed and dismissive, then you need to find another doctor. Every doctor is not a good match for you.